Okay guys, so next we will talk about the respiratory mucosa, the nasal concave, the nasal cavity, and the paranasal sinuses. I tried to draw a picture of the respiratory mucosa, but it wasn't coming out how I want to, and I feel like it would have confused you guys a little more than just explaining what it is. It's made up of epithelium and supporting lamina propria. It lines the surfaces of the turbinate bones and the meatus. So it's also made up of pseudostratified ciliated columnar epithelium and connective tissue. Next we have the nasal concave, which is right here. And it's also called the turbinate or the turbinole. So the epithelium, the respiratory mucosa lines the nasal concave. It works to increase the surface area of nasal cavities, and it allows warm, humidified air to pass through to the lungs. I don't know if you guys can see the pictures. I'm gonna go ahead. I'm gonna post pictures of the drawings at the bottom of the wiki so you guys have a better view of them. Next, we have the paranasal sinus, which is made up of 4 different sinuses, which is the frontal sinus, the sphenoid sinus, the ethmoid sinus, and the maxillary sinus. And it's drawn for you right here. In the pink, we have the frontal sinus, which is typically shaped like a triangle. Not an exact triangle, but it's triangular shaped, 3 different sizes. And it drains into the nasal cavity via the frontal nasal duct. Next, we have the sphenoid sinuses, which empties onto the roof of the nasal cavity. And it's important because the pituitary gland can be accessed, surgically accessed through this sinus. You'll go through the nasal roof, then next to the sphenoid sinus, and then you'll go through the sphenoid bone. And the sphenoid sinus is colored in the light blue, which is right here. Next, we have the ethmoid sinus, or ethmoid air cells, and it's the dark blue, the little tiny sinus right here. And it has 3 separate parts: the anterior, middle, and posterior. The anterior ethmoidal air cells empties into the hiatus semilunaris. The middle empties into the ethmoid bulla, and posterior empties into the superior meatus. And last, we have the maxillary sinus, which is orange, and it is the largest paranasal sinus of the 4. It's inferior to the eyes, so it's located right around here. And it drains into the nasal cavity through the hiatus semilunaris. So you have your frontal sinus, which is up here. Then you have your sphenoid sinuses, which is right here, like slightly below your eye. The ethmoidal is right here, or ethmoid cells is right here. Ethmoid here, sphenoid here. And then you have your maxillary, which is down here, and the largest ones. Last, we have the nasal cavity, which is here. This is what the nasal cavity looks like from a side view. And the bones that contribute to this cavity include both unpaired bones and paired bones. The unpaired bones are the ethmoid bone, sphenoid bone, the frontal bone, and the vomer bone. And the paired bones include the nasal bone, the maxillary bone, the palatine/lacrimal bone, and the inferior concave. Oh, and one thing I forgot to mention about the paranasal sinuses is that they are air-filled spaces that are located within the bones of the skull and the face. So in the next video, or the continuation of this video, I'll be talking more about the trachea, the bronchi, and its separate parts, and on all the other key components about that.